Check this out. If my doctor has included in my record I have headaches as a result from medication or just headaches in general, is that good enough for a diagnosis? Trying to get 50% for headaches because they are prostrating for hours almost daily. No. Diagnosis, symptoms, nexus. You don't want to wait 5 or 6 months and then get denied. Ah, fuck, this sucks. I kind of knew it. I knew it, man. I knew I was going to get denied. And then you have to go back and file a supplemental claim and then get medical evidence to submit in the appeals process. Now you're at 18 months. You could have just did this up front. Either way, you're going to need the medical evidence. Get it up front. This one, service connection for headaches. You were previously denied service connection because while your service treatment records reflects complaints, treatment, or a diagnosis similar to that claimed. Okay, let's look at that. It's a diagnosis. You need a current diagnosis. Reflects complaints, treatment, or a diagnosis similar. None of that shit's a diagnosis. So there's one thing. Read these decision letters that are in forums and stuff like that. You can get a lot out of reading from these things. We did not find a link between your medical condition and military service. The nexus is the link. We didn't find the link. We didn't put any effort into looking for it, but we still didn't find it anyway. You're fucked. Without evidence establishing a link between a headache condition and your military service, your claim remains denied. It will continue to remain denied. It's going to stay denied until you actually come up and give them the nexus link or give them an actual diagnosis. Symptoms are a little bit different because once you establish service connection, you have a rating. It may be 0% rating, but you don't have to worry about the diagnosis or the nexus anymore. Now you need to get these symptoms properly documented. Here's a list of going to the doctor. There's a scar. There's follow-up injections. There's severe lower back pain. There's some cramping and some other shit. It'll say diagnosis. Do you see a diagnostic code? No, this is just a list of doctor's visits, and this is not a clear diagnosis with a diagnostic code. This is just a problem list of sorts. Here's one for service connection for a neck condition. Your service treatment records do not contain complaints, treatment, or diagnosis for this condition. The evidence does not show an event, disease, or injury in service. It calls for a current diagnosis. So really, they don't even need to say contain complaints or treatment because they're irrelevant. What's relevant is the diagnosis, but your service treatment records don't have any of this shit. So kick rocks, veteran. Here's another one. This is in the My Healthy Vet stuff, the Blue Button Report. The famous SCT codes. Damn, this is looking pretty legit. This looks like it might be a diagnosis. Technically, this is a finding, meaning a clinically significant observation, but it's not a diagnosis. It's an SCT code. The VA uses a system called Systematic Nomenclature of Medicine for identification of patient problems. This, again, is not a diagnosis. None of these things are a diagnosis. You need a diagnosis, a current diagnosis. So none of these things are a diagnosis, so you need to find one. This is a diagnosis. Does the veteran have a diagnosis of PTSD that conforms to DSM-5 criteria? Yes. ICD code F43.10. Check. Yes. Going down the page. Mental disorder diagnosis number 1. PTSD. ICD code. And there's comments. This is a diagnosis, and this is exactly what you need to submit when you file your claim. You file this up front when you submit your claim, and then you have it. You have your diagnosis. You have your symptoms. You have your nexus. In this case, this is just covering the diagnosis part. You get medical evidence to support your disability from a doctor. Your evidence is going to be challenged at your C&P exam by another medical professional. They might be a real doctor, or a nurse, or a PA, or a chiropractor, or they might just be some other asshole. You don't know what you're going up against, so you want to get a real doctor to write a real opinion and diagnosis, symptoms, all that stuff for you, because you might be going up against another real doctor. It matters. The C&P examiner is hired by the VA to deny your claim. You're not paying for your C&P exam. The VA is paying for your C&P exam. They are getting paid to deny your claim. They're not on your side. You want a real doctor to go up against another real doctor. If your evidence comes from a nurse or a chiropractor and your C&P examiner is an actual real doctor, then your evidence will have less probative value. Now we're going to go into probative value because it matters and it's important. Probative value refers to the reliability and weight to be attached to the evidence concerned. That is your evidence. If you show up with none, you don't really have much reliability. It's all on the C&P examiner that's hired by the VA. If the evidence that you show up with is from a nurse or somebody that's lesser qualified than a doctor, then it's going to carry less weight. So you show up with your nurse medical evidence and you go up against a C&P examiner, he's a doctor. This guy's going to have more probative value every day of the week, all day long. That's just the way it is. Here's a snippet out of the M21-1 adjudication manual that covers the principles of reviewing and weighing evidence. This is what the VA raters do. They want to determine the probative value. They want to see if it's relevant. They're going to weigh the evidence and see how much probative value your evidence has. So if your evidence has none, they're not going to give you much. All right, I got it. Good enough isn't good enough. I need to win. What do I need to do? How do I do this right? You hire a real doctor yourself that's on your side that you pay for. That's how you do this. You don't rely on the C&P examiner. That's a hired gun by the VA. Let me jump in here real quick and tell you about my boot camp. If you want to learn more about the VA claims process, check out my boot camp. You can talk to me live. There's a link on the website and in the description, combatcraig.com. And also, if you need medical evidence like a nexus or documenting your symptoms properly, go to our website, combatcraig.com, and it says medteam/nexus letters. Click on that link, fill out the form, boom, you're done.